Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey everyone, thank you for joining me today. Gastro Girl's mission is to empower patients and caregivers. We provide fact-based information from doctors, advanced practice providers, patients, and in today's case, registered dietitians. Nutrition can play a really crucial role in our digestive health, and that's why I wanted to introduce you to Beth Rosen. Beth is a non-diet, weight-inclusive registered dietitian. Have you ever heard of health at every size? If you haven't, that's okay. Beth will tell us all about it today. She is also going to talk about her incredible role at GI OnDemand as the Director of Dietary and Nutrition Services. Welcome, Beth. Thanks so much for joining us today.
Thanks for having me, Jackie.
Well, you have quite an impressive background. You have, over 25 years of nutrition experience. You empower clients to improve their eating attitudes. You really help patients get off the diet cycle. And I love this. You really help people to eat intuitively. And these are not just buzzwords when we're talking to Beth Rosen. These are actual, put into practice, meaningful ways to describe her approach to dietary management of digestive health issues. I really am so happy that you're here today, because first we're going to talk about your role at GI OnDemand, which is really a cool role, I think.
Yes, well, thank you for that introduction. And yeah, all that's true. So I do really practice what I preach. But my role at GI OnDemand is one that I was really excited for when the opportunity arose. I'm the Director of Dietary and Nutrition Services. So my job is to create a network of dietitians across the country so that GI doctors can refer to them and make them part of their team, so that when a patient is being seen by one of our GI OnDemand gastroenterologists, they might also be referred to a dietitian or GI psychologist. They might go for genetic testing, so many different things, but it's really integrative care. So we want to make sure people from all over the country have access to this. And then the other side of what I do is I'm helping to create content and coursework for the, I think it's called the GI OnDemand University, right?
Yeah. So that's the area where we put all your wonderful courses, GI OnDemand University. Yep.
Right. So there's both free things there, free courses there, and courses that have a cost to them. And so many topics are there already, but so many more are coming. That's one place where you can find some information about health at every size, because I do have a free course on the weight inclusive approach to GI health.
Yeah, that's what we were just going to ask about. So your course is about the importance of weight inclusive management of GI health. And can you tell us a little bit about that course and what course takers can expect from listening in on that?
Yeah, so I want to define what weight inclusive is in case people don't know. So weight inclusive, the weight inclusive approach is an alternative to our current weight centric approach, where when you go to the doctor, you get weighed, you get told your BMI. Lots of times you might get told that if your BMI is in the overweight category or the obese category, that you have to lose weight. I work from a place where we sort of take weight out of the equation and look more at health behaviors. So a weight inclusive approach is treating everyone with equity and without harm, to talk about what health behaviors they can partake in to hopefully improve their health, independent of and regardless of the weight that they're at today.
So basically, we get so obsessed with what the number on the scale is. You kind of take that out of the equation, and it's really focused on the behaviors that could help reduce our symptoms by talking about what sort of dietary interventions may be necessary, without saying, okay, you only can eat X amount of calories because you need to lose X amount of pounds this month. You take that off the table.
Exactly. And in a lot of cases, bringing the conversation of calories or weight loss into the equation, more restriction can worsen GI symptoms. And also, it's unfortunate, but 35% of dieters end up with eating disorders. So I don't want to trigger that in anyone.
That's so important. I'm glad you mentioned that, because we did a really powerful episode with a gastroenterologist that talked about what gastroenterologists need to know about eating disorders in GI. And it was really an interesting podcast. So we'll have that information for patients as well. But I really think what you're doing with this course is so important. Who would benefit from taking your course?
Everybody. Everybody would benefit from learning about the health at every size philosophy. And health at every size doesn't mean that everybody's healthy at every size. It means that everyone has access to equitable healthcare should they choose to work towards wellness. And that's really what it's about. It's about embracing body diversity. It's about health enhancement. So doing activities and things that support your health, listening to your body to figure out what that is with the help of a registered dietitian or your doctor, whomever. It also incorporates respectful care. So things like weight bias or weight discrimination. So that really speaks to the providers, right? Like we all know that we have biases and we acknowledge those and try to work through them so that we offer people respectful care. And then there's also eating for well-being. So there's still eating as part of health at every size, but it's really about listening to what feels good in your body. And I incorporate that into all of my coursework and all the times I work with my clients, because it's important that we listen to our bodies, we see what feels good for us, and what feels good to me might not feel good to you. And so we have to get that piece that's called food body congruence, where how your body feels is in line with your values and how you want to feel and all those kinds of things. So if you eat something that makes you feel sick, you may not want to eat that anymore if you want to stay in line with how your body feels best.
Yeah, and this is so important, especially for patients, just any patient, but those of us who suffer with or are living with a GI condition. The symptoms can be maddening and they could be annoying and oftentimes debilitating, where someone might not be able to go to school or work, and maybe they keep eating the same thing and having the same symptom. And you can really help. A registered dietitian such as yourself can really help us understand those connections, right? It's not just, oh, I don't feel good. There's a reason why I don't feel good. Oh, I've been eating X every day and I feel like this.
And sometimes it's food, and sometimes it's stress, and sometimes it's lack of sleep. So we also need to consider what else in someone's life is getting in the way of them feeling well. And then also recognizing that lots of the GI disorders that we talk about don't have cures. So for some of them, flares are the nature of the disease. So there are going to be times when they don't feel good. And so teaching them about self-compassion and self-care, like when do you rest? When do you take a day off work, right? When do you have to wear loose clothing? Things like that. And that's part of it too.
This is so great. So if someone took your course, what could they expect to learn?
Well, if they're taking the course about the weight neutral approach to GI health, they're going to learn exactly what that means for them, how that would look like when they are seeing a provider, how to advocate for themselves so that if they're not getting the help they need, or if they are told to lose weight, or if their disease is blamed on their body size, how to manage that, how to cope with that harm and that stigma. And they'll learn all of that, but also, really learning how to advocate for themselves. So that, for many people with GI disorders, you don't just go to the doctor once and get a diagnosis. There's usually testing and back to this doctor and going to this doctor, right? Until there's like, okay, this is what it is. We've ruled out everything else and this is what it is. So it takes time, and you want to develop that relationship with your providers. So learning how to do that as well in a way that's caring for your body.
And I want to point out that registered dietitians such as yourself really work as part of the care team. You really work alongside the gastroenterologist and maybe a behavioral health expert like a GI psychologist to really help the patient. Is that correct?
Yes, we're a team. We all play our roles and we all have our lanes, and together we can really help someone feel good in their body.
Well, this is great. So this course is offered at no cost for patients, correct?
Correct. It's right on the GI OnDemand website. If you go on there, you'll see a button that says I'm a patient or I'm a provider. And if you click on the I'm a patient, then you'll come to the course list. And in there, you'll see a weight neutral approach to managing gastrointestinal issues. And if you click on that course, you'll be able to get instant access to it.
So Beth pointed out that the education area is available to the public, and you can access free as well as courses that have a nominal charge. And you've done a fabulous job working with the team and leading the team of dietitians to really create a very strong program for other digestive health conditions, like specific digestive health conditions, such as IBS. And one of the ones that you focused on recently was diverticulitis and diverticulosis. Now, what's interesting about these courses is it's really like working with a dietitian one-on-one, only it's available on demand. It's a video course series that's available on demand. And Beth, tell us a little bit more about the title of your course on diverticulitis and diverticulosis. And just tell us, who is this for? What can patients expect, and all that good stuff.
Yeah, so the course that I teach on the platform is called Nutrition Therapy for Diverticulosis and Diverticulitis. And this course is for anyone who has either diverticular disease. Both of them fall into that bucket. And, by the age of, I think, 80, so many of us, the majority of us, have diverticulosis. We just might not know it. And diverticulosis are these pockets that pouch out on our intestinal walls, and they're fine. They don't cause pain, right? Until they get infected. And then they can lead to diverticulitis, which is an infection of the diverticula, or those pouches. So my course really breaks it down into, if you've been diagnosed with diverticulosis, how to manage that so that you can prevent diverticulitis. And if you've been diagnosed with diverticulitis, how to manage the diet from the time you've been diagnosed and been put on medication, or have had surgery, or both. And then how to advance your diet so that you can get back to eating a regular diet.
That's great. So what else will patients learn? Do you give diet tips? Do you give anything like that? Like what, in nutrition tips, I should say?
Yeah, they will learn the step-by-step 3-phase diet to diverticulitis. So they will learn about the liquid diet, and they will then learn about increasing their diet to a low soluble fiber diet, and then finally to a full fiber diet. And the different phases depend on where they are in their recovery. And I explain how they determine when to advance as well.
That's great, Beth. I want you to touch a little bit on, there's so much noise out there. How do patients make sense of what to listen to, right? And what you've done here is, this is all evidence-based. So what Beth and the other dietitians and gastroenterologists and experts involved with GI OnDemand and the courses, it's all evidence-based, right?
Yes, indeed. And it's up-to-date evidence. So whereas maybe 10 years ago, and some doctors or some providers who don't know about diverticular disease may still be suggesting that people stay away from nuts and seeds and popcorn. And yet that's not the case, because research shows that that doesn't cause diverticulitis, and it doesn't lead to flares of diverticulitis. So I do bust some of the myths in this course as well.
So all the people, who maybe been avoiding popcorn, when they watch their movie, listen to Beth's course here. You might learn something that would make you very happy. Yeah,
there's no Dr. Google in my course.
Good. I love it. So this is so exciting. And it's a nominal charge for this. Rates for dietitians can be very expensive. Oftentimes people, and they should be, because you're very, very professional and very educated, but oftentimes access can be a problem. So what we've tried to do here is really make these courses accessible to every patient, and really help them.
Yes, I agree with you. I think the cost is fair, considering that it's my course at least is a 2-session course with a printable handout. You have instant access. You have access for life. As long as the course is up on the website, you can access it as many times as you want. And you can't really do that with a dietitian. You'd have to pay for every time you talk to them. So this way you get all of that information, and you can decide how you set the pace for how you watch it and how often you watch it, and you go back to it.
Yeah, and it's great. And oftentimes a lot of our patients end up working with the dietitian, either who led the course, maybe they want further one-on-one time, or maybe another dietitian as well can help them. What are some of the other topics that your team of dietitians cover for courses in this platform?
So far we've got IBS and irritable bowel syndrome. We've got treating fatty liver disease, non-alcoholic fatty liver disease with the Mediterranean diet. That one's great. It goes into depth, step by step through all the different foods that you can incorporate into your daily life to feel good. We have one that goes through the entire low FODMAP diet for irritable bowel syndrome. And then we also have the nutrition approach, which is an elimination diet for eosinophilic esophagitis, or EOE. So there's a bunch already, and we have a little list of what's coming up this year to be added to the platform. So we're excited to bring in more information for those who watch the course from an evidence-based perspective.
Well, this is great, Beth. I can't wait to see what's coming down the pipeline. I wish I had all the time in the world to sit back with my popcorn and watch some of these courses, because they really are really good. They're well done. And I think patients will really find them very, very valuable. I really appreciate your coming on today and talking about these great courses. Any final words for providers or for patients about these classes?
I would say go to the platform, go to GI OnDemand and check out the university, check out the free courses. They're really fun to watch. They've got great graphics. They make it really easy to understand. And if there's not something there, just reach out to us, and maybe that will be the next course that lands on the page.
Absolutely. We're always open to new ideas and input. So again, thank you so much, Beth, for your wonderful work with GI OnDemand and making the educational component of the platform so engaging and informational. Thank you so much.
Thanks, Jackie.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.